If you're turning 65 and still working, trying to decide, should I stay on my employer plan or should I start Medicare? That decision alone can actually cost you a lot of money through penalties, or worse, leave you without proper coverage. In this video, I take a deep dive into who can actually stay on their employer plan past 65, when it makes sense to do that, what to do when it's time to actually retire and come off that plan, and lastly, the penalties around Medicare enrollment windows and also HSA accounts. For those new to our channel here, I'm Joseph Pate, better known as Medicare Joe, and I speak with individuals every week with this exact situation that are staying on their employer plan. And it's important to know that the rules are not as simple as many people think. So I'm going to dive into all that in this video here, but make sure you stay until the end, because the rules around HSA accounts is something that really needs to be closely followed, because it can create a huge tax liability for you if it's followed incorrectly. So let's dive into the first question of, can I actually stay on my employer plan? So if you're working and you're turning 65 and you're planning to work past that, or you're on a spouse's plan that plans to work past 65, being able to delay your Medicare enrollment at that time really comes down to the employer size. So how many people are actually employed by the company? And it's pretty straightforward. So if you have 20 or more employees within the organization, you can delay your Part B enrollment of Medicare, the one that costs money to pay for, the medical insurance portion, and start it when you intend to retire at a later date. Now, if you have less than 20 employees, you need to actually start A and start B, the one you pay for, the medical portion. And what happens is your employer coverage becomes your secondary. It'd be very important to check that employer-based plan versus other secondary alternatives if that's the case for you. So it's important to identify this, and it may require you to speak with your HR to see if your coverage is considered creditable coverage in the eyes of Medicare. Again, the number is you need to have 20 or more employees and be actively on that work plan and working, or your spouse needs to be. So if we understand that a point of, can I actually stay on my work plan? The second evolving point becomes, does it make sense to? So again, we speak with people in this situation every week. And what I find that a lot of people that are on a employer-based plan nowadays are paying higher premiums. They have these enormous, large out-of-pocket maximums, deductibles. So even if you can delay your Medicare, it's important to look at the bigger picture of, does it make sense for me to actually do that? So when we do a deep dive into the two side-by-side comparisons of the employer plan versus starting Medicare, there's a couple things you need to review. Number one is, what are the premium breakdowns? Number two is, what are the deductibles? Are there networks? Prescription costs, because that differs how prescriptions are covered, from when you're on an employer plan to being on Medicare. Again, HSA contributions, more to come shortly on that. And lastly, would be the spousal or child dependency on the plan. For example, if you are the primary insured on that employer-based plan and you have your spouse that's not 65 yet, or even have kids that are on the plan, you might have to stay on that coverage to keep coverage for the whole family. So again, just because you can stay on an employer-based plan doesn't mean you should. You should do a deep dive into a side-by-side comparison, comparing the employer plan versus what Medicare actually has to offer. Now, let's say that you delayed your Medicare enrollment, though. You stayed on an employer plan past 65, and now you're ready to retire. Well, at that point, you need to start Medicare. So what happens is you actually get a second enrollment window. They call this a special enrollment period, a qualifying event. And this really is what catches a lot of people, because there's two enrollment windows that you need to satisfy. Number one, the main one that everybody knows about, is Part B. So that's, again, the medical portion of Medicare. When you lose coverage through your employer due to retirement and you're not actively working anymore, you have 8 months to get coverage, which seems like a long time to get coverage. However, the second enrollment window evolves around Part D, and that's the prescription drug portion of Medicare. This is the one that catches everybody. You need to enroll within 63 days of that loss of coverage on the employer plan. So if you miss these enrollment windows, penalties will actually apply for life being on Medicare. In the description below, I did a video of when do I need to enroll, and it talks about the penalties in there. I'll link that in the description so you can watch that. The most common issue around this piece is Cobra. People that retire and they think I'm going to stay on my Cobra plan to cover myself and maybe a spouse. That is not considered credible coverage to continue delaying your Medicare enrollment. It's a big mistake we see people make. If you're not working, you retired, and your employer plan has now come to an end, not Cobra, continuation of benefits, your enrollment window starts with Medicare at that point. And the last part I want to make mention of here is around HSA accounts, health savings accounts at your employer. If you enroll into any part of Medicare, Part A included, you can no longer contribute to an HSA. Let that sink in for a second. So Medicare Part A enrollment disqualifies you from contributing to an HSA. Most people automatically get Part A at 65. So if you're still working and contributing to an HSA, this matters, because what happens is if you delay that Medicare past 65 and you have Part A or later enroll in Part A, sometimes they'll even retroactively start at 6 months before you ask them to, because it's free, you don't pay for it. You may actually over contribute to your HSA without even realizing. You don't know what you don't know, and this is where people accidentally create tax problems later on for them. So what to do instead is, if you are contributing to an HSA and you decide that you're going to be staying on an employer plan and delaying Medicare, make sure that when you are delaying Medicare at 65, that you delay both Part B and Part A. And then when you are getting ready to retire, make sure you stop contributing to your HSA at least 6 months before your Medicare enrollment date, or your retirement date, let's call it. Again, this is one of the biggest mistakes we see people make that are still working, who are doing everything right, but no one explained, this interaction to them. What I want you to take from this video as a recap, here's really what to remember from today. Your employer size determines if you can delay Medicare or how you have to start Medicare. Number two, even if you can delay Medicare, does it make sense to actually do so? You might be able to get better coverage or more affordable coverage by starting Medicare. Number three, when you retire, you need to enroll within that enrollment window to avoid those lifetime penalties. Cobra does not suffice as credible coverage. And then again, if you're participating in an HSA, it's important to navigate that correctly to avoid any tax problems down the line. So if you're on Medicare, or if you're about to be on Medicare and want to make sure that you're doing everything at the right time, making the right choices, there's a link below in the description. You can book a call with one of our team members. We'll walk through your situation and make sure that you are avoiding any mistakes. And if you like this video, please give us a like. That helps push this content to other folks just like yourself. If you're just in the research phase of Medicare right now, it'd be worthwhile to click that red subscribe button. We post Medicare videos weekly to educate the population on what happens around Medicare and what you need to know. Thanks for watching.